presentation, we will be discussing dietary choices and how they relate to breast milk composition, specifically vegans and vegetarians, and how that affects how you feed your baby. So for a little background about human breast milk composition, human breast milk is said to be one of, if not the most nutrient-dense substances for your baby. According to Johns Hopkins, compared with formula, the nutrients in breast milk are better absorbed and used by the baby. These include sugar, which is carbohydrate, and protein. Human breast milk contains carbohydrates, proteins, fats, vitamins, minerals, digestive enzymes, and hormones, all specifically created by the body for the baby. Human breast milk has a general composition of 87% water, 3.8% fat, 1% protein, and 7% lactose. And according to a study conducted in 2016, a review of infant feeding, the fat and lactose provide 50 and 40% of the total energy of milk, respectively. But the human composition, or the composition of human breast milk, is dynamic. It changes over time, and it adapts itself to the changing needs of the growing child. So for example, during each nursing session, the milk that is expressed first is thinner with a higher content of lactose, which satisfies the baby's thirst. And following, there's foremilk, there's hind milk, which is a little bit creamier with a higher content for the baby's needs. So it's very adjustable. We'll go into what that means for changes in dietary choices for the mother as we go through the presentation. Also to mention, according to the Mayo Foundation, lower levels of both vitamin B12 and omega-3 fatty acids were found in breast milk from both vegan and vegetarian mothers as compared to those who ate animal products, and that was from a 2023 study. Next, we will discuss some general facts about breast milk and breastfeeding. So I touched a little bit on this previously about how breast milk composition changes based on the baby's needs. One of the ways that they do this, or that it does this, is by helping to fight disease. So human milk oligosaccharides possess anti-infective properties against pathogens in the infant GI tract, which is very interesting. And according to Johns Hopkins University, breast milk can prevent mild to severe infections and hospitalization. It can protect against salmonella, listeria, campylobacter, things like that, things of that nature. And the World Health Organization recommends that infants should be exclusively breastfeeding for the first 6 months of life. Now, this is a very idealistic thought process. Of course, some women can't produce breast milk as easily or have troubles with the breastfeeding process or experience. That's neither here nor there. And overall, the nutritional quality of human milk is highly conserved, but attention to maternal diet is important for some vitamins and the fatty acid composition of human milk. So the fatty acid composition is a big factor that is affected by maternal diet, which I found to be very interesting. So this slide sort of details some general information about a vegan diet and how it relates to breast milk composition, maternal and fetal health. So starting off, as we all know, typically the vegan diet lacks adequate sources of vitamin B12 because typically they come from animal products like dairy and meat. So here, yes, it states that vitamin B12 deficiency is highly prevalent in vegetarians and vegans. However, lacto-ovo-vegetarianism tells a little bit of a different story because including dairy and egg products increases the vitamin B12 content in the diet. Vegan diets are increasingly popular, especially among young women. Prevalence of 2% to between 2 and 4%. Which is relevant because this is the same age group as women who would be giving birth or who would be breastfeeding. According to a study conducted in 2009, quoted by the American Dietetic Association, well-planned vegetarian diets are appropriate for individuals during all stages of the life cycle, including pregnancy, lactation, infancy, childhood, and adolescence, and for athletes. We'll go into a little bit more in-depth detail about that in a little bit. Also states that individuals obviously go towards the vegan route for a number of reasons, but recent epidemiological evidence has found that the vegan diet is nutritionally adequate, but there are no strict advantages for a strict vegan diet that has been proven as of yet. According to the Mayo Foundation, vitamin B12 is essential for the proper cognitive and physical development of an infant. Research shows that women who do not consume animal products are at high risk for B12 deficiency. In turn, their breast milk can become deficient, resulting in infant deficiency of B12, which again can affect cognitive and physical development. According to the CDC, infants who drink breast milk from a mother who consume adequate amounts of vitamin B12, or infants who drink infant formula, will receive enough vitamin B12. However, if a breastfeeding mother is deficient in B12, her infant may also become deficient. Supplementation is an effective way to increase dietary intake of nutrients like B12 and omega-3 fatty acids, which are the nutrients in question at this time. One way to incorporate B12 into the diet without consuming animal products is to include fortified grains and cereals into the diet. Also, B12 injections regularly. Another way to incorporate omega-3 fatty acids is to supplement with microalgae. Those are just some ways to include it without consuming animal products, because research shows that vegan women who take vitamin B12 supplements saw a marked increase in breast milk concentration of B12, as shown on the tables on the slide, even when dietary intake was insufficient, and that is from Pawlak 2018. So now we start to piece everything together a little bit more. I have a big chunk quoted from an abstract of an article conducted in 2021. This article is a systematic review that analyzes 13 publications, as you can see, concerning the impact of dietary pattern and levels of animal origin food intake on breast milk composition. So they have found that all non-vegetarian, vegetarian, and vegan mothers produce breast milk of comparable nutritional value. Several differences are primarily attributed to fatty acids, which were mentioned earlier, and some microcomponents, including vitamin B12, which also was mentioned previously. The same study states that regardless of dietary choices, nourishment and adequate nutrition have a significant impact on human milk composition. On the basis of current evidence, and very current actually because 2021, vegetarian and vegan mothers are capable of producing nutritionally valuable milk for their infants as far as the appropriate supplementation compensation for breastfeeding mothers' nutritional requirement is provided. So that's a very important takeaway I feel like we can all consider from this discussion, is that the breast milk provides nutrition for the individual infant based on their, once again, individual needs, and dietary choices affect primarily fatty acid composition and vitamin B12 composition, but not necessarily human milk composition specifically, and it still provides adequate nutrition for the infant regardless of the dietary choice. And then another study states that maternal diet does not affect macronutrient content in human milk, so that includes fat, protein, and lactose. These are my cited sources. Thank you for listening, and I hope you learned something.